Hello, I'm Dr. Udesh here. Again, came with some of the serious problems that I'm just observing here in the uh, daily clinical practice. And one of the most important thing that I observe is the raised diastolic blood pressure in young adults. Although patients of middle age or old age patients, they are having, if they are having hypertension, the main thing that is increased is systolic blood pressure, that goes beyond 140. But in the young adults, those are who are working or even who are studying, so in the young adults, the most prevalent thing that is been found is the raised diastolic blood pressure. And if the systolic blood pressure is in the range of 130 to 140, means it is, if it is normal, and if the diastolic blood pressure increased above 80 or 90, so that is called isolated diastolic hypertension, IDH. And that may be some kind of serious problem. But actually what is happening here, that most of the research are concentrated and most of the trials are concentrated on the systolic hypertension, and even diastolic hypertension is also being now studied, but there is not very much that kind of study, and not very much kind of studies that shows any kind of conclusion in respect of the diastolic hypertension. But still, if someone is having diastolic hypertension, then he has a more risk of developing cardiovascular disease and cardiovascular events and organ damage than the person having normal blood pressure. So one thing is very important, that doing yoga and pranayama is very much important. Having mild exercise, about 30 to 40 minute exercise, and these kinds of things can really decrease the stress in the young adults. And if it is not been controlled about that, then the clinician, you should ask about the clinician to initiate some kind of medicines. And most effective medicine is being employed is the ACE inhibitors, like enalapril and ramipril. If there are some kinds of side effects, like the dry cough and whatever it is, then ARB can also be initiated, that is angiotensin receptor blocker, like telmisartan or valsartan, that may be effective. But I again repeat that you do not take the medicine on your own. Must discuss the things with the clinician. And there are lots of study being going on, but today on the present, there are not very much conclusive study on the isolated diastolic hypertension. There are myths. There may be myths, and there may not be any kind of conclusive evidence about the IDH. But still, if there are things that is happening with you, that your diastolic blood pressure is raised, you must visit your clinicians and follow their instructions. Thank you very much all.